So hello बच्चों, and coming to a very important topic, the front of the arm. Front of the arm, ये वाला सबको पसंद है ये. What is this? The front of the arm. ये जो मसल है ना, सबको पता है, biceps, right? Biceps. So we'll start with the front of the arm. Muscles देखेंगे in front of the arm. The nerve supply of all these muscles, that is very important. ये हमेशा वाइवा में भी पूछते हैं. This is asked in MCQs also. And short note on the muscle also comes. Muscles पे भी short note आते हैं, ठीक है? तो students, starting with the front of the arm, I'm sure you must be seeing the entire series of lectures and आपको समझ में जरूर आ रहा होगा. अगर कुछ भी doubts है तो send your doubts in the comment box. I'll definitely answer to it. ठीक है बच्चों? तो चलते हैं front of the arm की तरफ. Front of the arm. Okay, I'll start. Look. And learn to draw such diagrams. ऐसे ना, learn to draw such diagrammatic representation. No one requires a beautiful diagram, but so that's the scapula. That's a costal surface of the scapula. This is the coracoid process. ये पीछे acromion process. That's a glenoid cavity. This is the humerus. Humerus. Fine. Lesser tubercle, greater tubercle. The medial lip of the bicipital groove. The lateral lip of the bicipital groove, and that's the bicipital groove. Fine. The medial lip of the intertubercular sulcus भी बोलते हैं, lateral lip of intertubercular sulcus भी बोलते हैं, and the intertubercular sulcus, which is also known as the bicipital groove. I'm sure you must be knowing all this. Bony landmarks का भी एक playlist है, हाँ, bones of the upper limb का playlist है, वो भी देख लो. So that's the lesser tubercle, greater tubercle, the medial lip, lateral lip of the bicipital groove, and that's the bicipital groove. ठीक है? अब front of the arm, there are three muscles in front of the arm. Yes, any guesses? Guess कर सकते हो? That's biceps. अब बच्चे बोलते हैं biceps. So there's a biceps in the lower limb also. Lower limb में भी एक biceps है. Biceps का मतलब दो heads. There are two heads. It is therefore known as the biceps. अब this is in the arm. Arm is known as the brachium. Arm का दूसरा नाम है brachium. So this muscle is what we call as biceps brachii. Okay, biceps brachii. So the first muscle is biceps brachii. Similarly, we have a muscle in lower limb, biceps femoris. Biceps femoris. तो ये है biceps brachii. ठीक है? That's the first muscle. Second muscle is the muscle of the arm. वो खुद arm में ही है. What is that known as? Arm is known as brachium. The muscle is known as the brachialis. Brachialis. So muscle का नाम है brachialis. And third, छोटा सा muscle, a small muscle, begins from the coracoid process to the arm. That's the coracobrachialis. 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 So which are the muscles in front of the arm? Biceps brachii, brachialis, coracobrachialis. Right? Simple है, बहुत easy है. Now biceps short note भी आता है. Biceps comes as a short note. Why is it known as biceps? Because it has got two heads. Two heads of origin है biceps. Fine. So एक है long head, one is short head. The long head of biceps brachii arises from, have a look. What is this? That's a scapula. ये क्या है? Glenoid cavity of scapula. This is the supraglenoid tubercle. This is the infraglenoid tubercle. The supraglenoid tubercle gives origin to the long head of biceps brachii. Supraglenoid tubercle gives origin to long head of biceps brachii. The infraglenoid tubercle gives origin to long head of triceps. Long head of triceps. Fine. Okay, so the long head of biceps begins from the supraglenoid tubercle. This is intracapsular in origin. Intracapsular मतलब it is inside the capsule of the shoulder joint, right? वैसे इंट्राकैप्सुलर मसल्स आर टू, दो होते हैं बॉडी में इंट्राकैप्सुलर मसल्स. वन इज द लॉन्ग हेड ऑफ बाइसेप्स ब्रेकाई. सेकेंड, यस, गेस करो, इंट्राकैप्सुलर मसल्स. वन इज लॉन्ग हेड ऑफ बाइसेप्स ब्रेकाई. द सेकेंड वन popliteus. Very good. That's a popliteus. So the long head of biceps brachii कहाँ से begin होता है? Supraglenoid tubercle. This is inside the shoulder joint. It will pierce the capsule. It will come out. It passes through the bicipital groove. देखो, it is going through the bicipital groove. समझ में आ रहा है? So long head of biceps is always tubular. ट्यूब के जैसा होता है, ट्यूब के. This is asked in vivas. हाँ, जब आप muscle identify करोगे, what is this? You say, sir, long head of biceps brachii. Why? Because it is lying in the bicipital groove. Because it is tubular, tube के जैसा होता है, so that it fits into the bicipital groove, है ना, वो fit होना चाहिए, it should fit into the bicipital groove, so it is tubular. समझ में आ रहा है ये? Fine. Now the short head of biceps is like a flat tendon. Look, yeah, na, this is the short head of biceps. It arises as a flat tendon. It arises from the coracoid process of scapula. Coracoid process of scapula along with Coracobrachialis. उसके साथ और एक मसल आता है Coracobrachialis. दो फ्रेंड्स है, फ्रेंड्स, both of them are friends. Short head of biceps brachii and Coracobrachialis, they come together, साथ में आते हैं. So the short head of biceps brachii arises from the coracoid process. It is a flat tendon, ऐसे flattened tendon होता है. Long head of biceps is tubular, tube के जैसा. Now this short head will join with the long head. ये दोनों join होंगे. अब ये बनेगा belly of the biceps. Belly is the main muscle. हम main muscle को बोलते हैं belly. We are reflecting the biceps. मैंने biceps को reflect किया, ऐसे reflect किया. We have turned it. ऐसे turn किया biceps को. Now this biceps comes and gets inserted on. ये कौन सा bone होगा? Forearm. Forearm के bones है. There are two bones in the forearm. एक है radius, दूसरा है ulna. Lateral side पे radius, medial side पे ulna. That's the head of the radius, that's the neck of the radius, that's a radial tuberosity. Head of the radius, neck of the radius, radial tuberosity. So where is the insertion of biceps brachii? Biceps brachii is inserted on the radial tuberosity. Radial tuberosity पे insertion है biceps brachii का. Simple, easy, very easy. This is how you draw it. So देखो, once again, biceps brachii, two heads, long head, short head. Long head arises from the supraglenoid tubercle. Long head is intracapsular. It passes through the bicipital groove. It is tubular, tube के जैसे होता है. It passes through the bicipital groove. The short head arises from the coracoid process of scapula. It is like a flat tendon के जैसा है. The short and the long head joins to form the belly of the biceps. Inserted on the radial tuberosity. Inserted on the radial tuberosity. Fine. Now, कितने joints cross कर रहे हैं? Biceps is crossing how many joints? Two joints. One is the elbow joint. Second is the shoulder joint. Elbow and shoulder joint. What is the main action of biceps on the elbow joint? Elbow joint पे main action क्या है? It does supination at the elbow joint. Supination at the elbow joint. But not in an extended position. ये position में नहीं करता है. In a mid-flex position. This is flexion. This is extension for the elbow joint. This is mid-flexed. मतलब half flexed. ठीक है ना? ये extended forearm है. ये flexed forearm है. This is a mid-flexed forearm. In this mid-flexed forearm, biceps is a powerful supinator. सबने try किया होगा ना घर पे. Screw loose हो गया. Furniture का screw becomes loose. So you take a screwdriver and you do this, you do this, you do this. So this is what? This is supination. This is supination. This is supination. So the biceps helps in screwing movements. मतलब screw को tight करने के लिए we require the biceps. So the main action of biceps is supination in a mid-flexed forearm. Mid-flexed forearm में supination. Second, flexion at the elbow joint. Third, flexion at the shoulder joint. Flexion at the shoulder joint. समझ में आ रहा है? So what is the action of biceps on the elbow joint? It is a chief supinator in a mid-flex position. It is a flexor of the elbow joint. It is a flexor of the shoulder joint. And the long head of biceps ऐसे ऊपर से आता है. It comes from above. So it prevents the upward dislocation of the humerus. The long head of biceps brachii prevents the upward dislocation of the humerus. Perfect है? So first things first. जो important है वो first बोलना. You don't have to say flexion at the elbow joint. That's flexion at the shoulder joint. That's not the first answer. Don't say flexion at the elbow joint as your first answer. अगर examiner पूछता है what is the action of biceps brachii, your answer is number 1. Sir, it is the chief supinator in a mid-flex forearm. Second, it is a flexor at the elbow joint. Third, it is a flexor at the shoulder joint. And fourth, the long head prevents the upward displacement of the humerus. Am I clear? दैट्स अबाउट द बाइसेप्स. नर्व सप्लाई क्या है इसका? मस्कुलोक्यूटेनियस नर्व. विल सी टू इट. अभी इसके बाद देखते हैं मस्कुलोक्यूटेनियस नर्व. ठीक है, फाइन. नाउ कमिंग टू द सेकंड मसल. सेकंड मसल बिगिंस फ्रॉम द ह्यूमरस. देखो, दिस मसल बिगिंस फ्रॉम द हाफ ऑफ द ह्यूमरस. हाफ, हाँ, हाफ ऑफ द ह्यूमरस, लोअर हाफ ऑफ द शाफ्ट ऑफ द ह्यूमरस. दैट्स द शाफ्ट ऑफ द ह्यूमरस. ह्यूमरस को दो हाफ में डिवाइड करो, अपर हाफ, लोअर हाफ. So lower half of the shaft of the humerus, ये muscle arise होगा, that is the brachialis. Brachialis. Brachialis is arm. So what is the origin of brachialis? It arises from the lower half of the shaft of the humerus. Lower half of the shaft of the humerus. Now this brachialis, उसका insertion कहाँ पे होगा? That's the ulna. That's the ulna. That's the ulnar tuberosity. हाँ, ये क्या है? Ulnar tuberosity. That's the ulnar tuberosity. What was this? Radial tuberosity. That's the radial tuberosity. That's the ulnar tuberosity. So brachialis का insertion is on the ulnar tuberosity. It's inserted on the ulnar tuberosity. समझ में आ रहा है? So brachialis simple है, छोटा सा muscle है, begins from the lower half of the shaft of the humerus. Lower half of the shaft of the humerus. It is inserted on the ulnar tuberosity. अब it crosses only one joint, correct? एक ही joint cross करता है, which? Elbow joint. So what is the action on the elbow joint? It is a chief flexor of the elbow joint, main flexor. Biceps भी flexion करता है, but if I have to select main flexor, that is brachialis. Brachialis एक ही joint cross करेगा, it crosses only one joint, it is going to cause flexion at the elbow joint. Perfect है? Insertion is on the ulnar tuberosity. Perfect. एक last muscle है coracobrachialis. Now coracobrachialis begins from, I'll draw like this, it begins from the coracoid process. It begins from the coracoid process along with short head of biceps brachii. तो short head of biceps brachii के साथ आता है. Wait, I'm also coming. Short head of biceps brachii is going towards the humerus. The coracobrachialis बोलता है wait, मैं भी आता हूँ. I'm also coming. So the coracobrachialis begins from the coracoid process and बस ये यहाँ पे insert हो जाता है. Where is it inserted on? Humerus को दो half में divide करो. Divide the humerus into two half. So middle half of the shaft of the humerus, correct? This is the middle half of the shaft of the humerus on the medial aspect. That's a medial aspect. So coracobrachialis का origin is the tip of the coracoid process along with the short head of biceps brachii. Insertion is on the medial aspect of the shaft of the humerus. Medial aspect of middle half of the shaft of the humerus. Middle half of the shaft of humerus. Perfect. Coracobrachialis will act on the shoulder joint. Shoulder joint. एक ही joint cross कर रहा है, ये ऐसे जा रहा है, so it will cause flexion at the shoulder. It's a very weak flexor at the shoulder joint. Weak flexor at the shoulder joint. ठीक है? So this is how the muscles are. I hope I'm clear to all of you. तो ये है long head, and that's a short head of biceps. Long and short head of biceps brachii. What is this muscle? This is the brachialis. Brachialis. ये muscle है brachialis, and this muscle is coracobrachialis. That's the coracobrachialis. Perfect है? So that's how you understand it. Simple है बच्चों, बहुत easy है. एक बार देख लो, just see the slide. ये slide देख लो. This is the slide. अब देखो, what is this muscle? ये बड़ा सा muscle. What is this big muscle? This is the biceps brachii. अब biceps brachii को I've reflected. मैंने biceps को turn किया. What is this? That's the brachialis. And what's this? Coracobrachialis. Coracobrachialis. So coracobrachialis arises from the coracoid process. ये है coracoid process along with the short head of biceps brachii. Coracobrachialis का insertion is on. You divide the humerus. ऐसे divide करता है. The medial aspect of the middle half of the shaft of humerus. That's coracobrachialis. ठीक है? Now, what is this muscle? ये है long head of biceps brachii. समझ में आ रहा है? Look at this. That's a long head of biceps brachii. It is beginning from the supraglenoid tubercle, it is passing through the bicipital groove. यह है short head of biceps brachii which begins from the coracoid process. Both the heads joints inserts on, what is this for the radius? Head. यह है head, that's a head, that's a neck, that's a radial tuberosity. Inserts on the radial tuberosity. यह है brachialis and its insertion is on the ulnar tuberosity. Perfect है बच्चों? This should be very clear. हाँ, इसमें बहुत MCQs भी है. The long head of biceps is intracapsular in origin. The action of biceps, the action of brachialis, the action of coracobrachialis, everything is important. That's about the front of the arm, muscles. Abhi coming to the nerve of this compartment. ये compartment का nerve कौन है? Which is the nerve of this compartment? This nerve supplies this muscles. ये muscles को तो supply करती है. And it itself becomes cutaneous. It itself becomes cutaneous. Naam, the musculocutaneous nerve. Musculocutaneous nerve. So the nerve supplies the muscles and खुद cutaneous बन जाता है. That's the musculocutaneous nerve. बच्चों, can anyone tell me something about the musculocutaneous nerve? हाँ, कुछ बोल सकते हो? It's a branch of which cord? चलो, musculocutaneous nerve, I'll tell you. Musculocutaneous nerve, it's a branch of, चलो बोलो, branch of lateral cord, है ना? ये हमने देखा है, branch of lateral cord. Second, उसका root value बताओ, root value C5, C6, C7, C5, C6, C7, ठीक है ना? तो कोई भी nerve when we are trying to explain, तो पहला तो branch of which cord? Second, उसका root value. Third, it's a relation to the axillary artery. Relation to the axillary artery. So this is a nerve, musculocutaneous nerve है. So where will it be found? Third part of the axillary artery. जितने भी nerves है, they are present in the third part of the axillary artery. Now this is a branch of lateral cord. तो कहाँ मिलेगा? Third part of the axillary artery, lateral aspect. समझ में आ रहा है? Nerve है, all the nerves third part of axillary artery में होते हैं. But you have to know it's a branch of which cord. So musculocutaneous nerve is a branch of lateral cord. तो ये कहाँ पे मिलेगा? Third part of axillary artery on the lateral aspect. Okay. So present on the lateral aspect of third part of axillary artery. Third part of axillary artery. Present on the lateral aspect. I'll just write present on the lateral aspect of the third part of axillary artery. ठीक है, यहाँ तक clear है? So musculocutaneous nerve is a branch of which cord? Lateral cord. Root value C5, C6, C7. उसका relation with the axillary artery, it's lateral to the third part of axillary artery. Now this musculocutaneous nerve pierces this muscle. ये muscle को pierce करती है. What is this muscle? Coracobrachialis. दिख रहा है ये जो musculocutaneous nerve है ना, this pierces the coracobrachialis. Now it lies on this muscle. ये कौन सा muscle है? Brachialis. हमने brachialis देखने के लिए क्या किया है? What have we done to see the brachialis? We have reflected the biceps. Biceps को reflect किया है, so that's the brachialis. So the nerve is lying on the brachialis. And below what? Biceps brachii. It is below the biceps and on the brachialis. In other words, the nerve lies between what and what? The nerve lies between the biceps and the brachialis. समझ में आ रहा है? So the first nerve pierces the coracobrachialis, lies on the brachialis, below the biceps, and now it becomes cutaneous. यहाँ पे cutaneous बन जाती है and it supplies the skin on the lateral aspect of forearm. अब ये skin को supply करेगा lateral aspect of forearm. This is what we call as the lateral cutaneous nerve of forearm. Lateral cutaneous nerve of forearm. This lateral cutaneous nerve of forearm is a continuation of musculocutaneous nerve. It's a continuation of musculocutaneous nerve. समझ में आ रहा है? So musculocutaneous nerve, number 1, branch of lateral cord. Number 2, उसका root value C5, C6, C7. Number 3, present on the lateral aspect of third part of axillary artery. Number 4, pierces the coracobrachialis. 5, lies between the biceps and the brachialis. 6, continues as the lateral cutaneous nerve of forearm. Lateral cutaneous nerve of forearm. ठीक है? तो ये लिख देते हैं, present on the lateral aspect. Then 4th, pierces coracobrachialis. ठीक है? Lies between biceps brachii and brachialis. brachialis, and last continues as, so everything is done, continues as the lateral cutaneous nerve of forearm, continues as the lateral cutaneous nerve of forearm. तो ये क्या सप्लाई करेगा? इट सप्लाइज द स्किन ऑन द लैटरल एस्पेक्ट ऑफ फोरआर्म फ्रॉम द एल्बो जॉइंट टू द wrist joint, एल्बो जॉइंट टू द wrist joint, स्किन को सप्लाई करेगा. ठीक है बच्चों, आई होप दिस इज क्लियर टू ऑल ऑफ यू. लुक एट दिस नर्व, ये नर्व देख लीजिए. दिस इज द musculocutaneous nerve, दिस इज द lateral cord. So this is the musculocutaneous nerve. It pierces the coracobrachialis. देख रहे हो, it pierces the coracobrachialis. तो ये nerve, how do we identify this nerve, or how do we identify the coracobrachialis? Because the musculocutaneous nerve pierces the coracobrachialis. It now lies between the biceps and the brachialis, and it continues as the lateral cutaneous nerve of forearm. ठीक है, वो क्या सप्लाई करेगी? It supplies three muscles. It supplies the biceps, the brachialis, and the coracobrachialis. Biceps, the brachialis, and coracobrachialis. Fine. Look at this slide. चलो बच्चों, can you identify this? What is this? That's a biceps. That's a long head. That's a short head of biceps brachii. ये biceps को cut किया है. This is the biceps which is cut. What is this muscle then? Brachialis. ये क्या muscle होगा? Brachialis. What is this muscle? That's the coracobrachialis. ये है coracobrachialis. This is the musculocutaneous nerve. ये coracobrachialis को pierce कर रही है. Now it is lying on the brachialis. Biceps को cut किया है, and now it continues as the lateral cutaneous nerve of forearm. Lateral cutaneous nerve of forearm. Perfect है बच्चों. I hope this is clear to all of you. I hope this is clear to all of you. क्या बोल रहे हो? Clear है कि नहीं? सिंपल है. ओके, इट्स वेरी इजी. तो एक बार वापस देखो क्या डिस्कस किया हमने. एक प्रेसेस, शॉर्ट प्रेसेस. व्हाट हैव वी डिस्कस? फ्रंट ऑफ द आर्म. फ्रंट ऑफ द आर्म में तीन मसल्स हैं. बाइसेप्स ब्रेकाई, कोराकोब्रेचियालिस, ब्रेचियालिस. नर्व ऑफ दिस कंपार्टमेंट इज मस्कुलोक्यूटेनियस नर्व. Biceps brachii के दो हेड्स हैं, लॉन्ग हेड, शॉर्ट हेड. लॉन्ग हेड arises from the supraglenoid tubercle of scapula. Intracapsular होता है ये. It is tubular, passes, lies in the bicipital groove. Short head coracoid process से आता है. Joints with the long head, forms the belly, inserts on the radial tuberosity. Main action, chief supinator at radial joint. Second, flexor at the elbow joint, flexion at the shoulder joint. The long head prevents the upward dislocation of the humerus. खत्म. Brachialis arises from the lower half or middle half of the shaft of the humerus. Lower part of the middle half of the shaft of humerus. Insertion is into the ulnar tuberosity. Main action is only flexion, or it is the main flexor of the elbow joint. Coracobrachialis begins from the coracoid process, inserts on the medial aspect of the middle half of the shaft of the humerus. Action, flexion at the elbow joint. Nerve supply, again coracobrachialis. Nerve supply, I'm so sorry. Nerve supply is musculocutaneous nerve. And then फिर हमने musculocutaneous nerve को describe किया. Branch of which cord? I hope this all is clear to you. है ना, ये सब clear हुआ ही होगा. So बच्चों, ये series देख लेना. Brachial plexus मैंने कराया. Front of the arm I've done. हाँ, many topics I'm aligning you all to. तो देख लो, समझ लो. अगर कुछ भी doubt है तो just get back to me. Write your comments in the comment box. That's my YouTube channel. This is my Instagram handle. ये भी आप log in करके देख लो. इसमें काफ़ी छोटे छोटे reels है, educational reels. That's my Telegram. ठीक है बच्चों, and video end तक देखना to have a proper understanding and उसे correlate करिए. Thank you so much once again from the entire team of Anatomy Unlimited. Thank you. Bye bye.